right, welcome. Hope everybody got some pizza. This is our healthcare management career chat, and we are fortunate to have two accomplished center alums in the field of healthcare management. We have Amanda Henson, and she is Vice President at Baptist Health Systems here in Kentucky. And we have John Rucker, and he is Director of Growth and Development at Health First, and he's down in Central Florida. So what they're going to do is both talk a little bit about their career path, tips from the field, trends, that kind of thing, just some good general information about the field. And then once they each do that, you guys can answer questions. So, or ask some questions. Be sure to be thinking about those as we go through it. So that's kind of the kickoff, and I think we agreed that Amanda was going to start us off.
Great. Well, thank you so much, and I'm super jealous that you all have got pizza right now because I'm like, oh, I got to get lunch after this. But anyway, it's great to see you all in such a big group. I was at Center and graduated back in 2002, which is hard to believe, and I'm getting that old. But anyway, I was majored in psychology, and at the time tried to decide what I was started at Center, and I think it was chemistry that knocked me out of that. So I wanted to still stay involved in healthcare in some way, and so a family friend of mine was in a corporate position at Baptist in Louisville at the time, and he recommended I look at healthcare management. Vice President of Strategy and Planning for Baptist Healthcare System, and I went and met with him and thought it sounded interesting, and actually did an internship at Ephraim McDowell. I think it was my senior year, and with the CEO there, and spent sort of a semester shadowing and trying to get an idea of what is this thing that is healthcare management, and how, is that something that I could see pursuing, and, coupled that with some leadership opportunities that I had while I was at Center in my sorority. I was like, well, actually this might be a good direction for me. So I really jumped into it and pulled the U.S. News and World Report and said, okay, what grad schools are in the top 10 and areas in which I thought I could live. And so that knocked out Minnesota. But I ended up going to UAB for a dual program there for my master's in healthcare management or healthcare administration, and then my MBA as well. So they had a dual degree program. Went right out of Center into that and was in class. It's an in-class program for 2 years, and then you have a year-long administrative fellowship or residency. And so that took me to Florida, in Jacksonville, Florida, with Shands in the University of Florida for about 3 years. I stayed there, and then progressively have worked my way back to Kentucky. I'm actually from Louisville to begin with. And so I'm now in Lexington, and I've been in this position as Vice President for Cancer Services, as well as several other ancillary departments in the hospital now for about 7 years. And so actively doing work across Baptist Health System. We're an 8-hospital system in Kentucky and Southern Indiana. So have enjoyed it. I loved the thought of not every day being the same, and there being a constant challenge to my work day. And so not a day goes by that doesn't happen. But, I think this field is really interesting. It's, I think there's a lot of opportunity, particularly if I was your age looking at it again, because I think we've got baby boomers that are still hanging on in these careers, probably for another 5 or 6 years. But I think there's going to be some openings within a lot of the senior leadership positions within hospitals, and not all the works in hospitals. John can talk to the career path that he's in, but physician offices, practices, managed care companies. And so it's a really broad field. And I think, pursuing either your master's in healthcare administration or your master's in public health could open a lot of doors into an industry in which, you might be interested in medicine in some way, but not actually going to go down the career path of being a nurse or a physician. That's not to say we don't have nurses and physicians who also are in leadership roles, that there's quite a few of those. I think it's been very rewarding because you still make a difference in what you're doing, and you're still working right alongside of the clinical providers in the facilities to, make positive change for patient care. So it's been a great opportunity for me. Again, I think the cards sort of laid out really well in sort of the path that I took. And I was given at Center to sort of get me clued into, some of my interests. So I look forward to hearing any questions you all have, and I'll turn it over to John to sort of tell you his story.
Thank you.
See if I mute now. Okay, so I graduated from Center in 2012 with an anthropology and sociology major. I didn't really know what I wanted to do as far as a career at that point. I spent the summer between my junior and senior years in Peru with Dr. Cutright, who is still at Center, and we were digging up some old stuff on the north coast of Peru. And I realized that I liked indoor showers and Wi-Fi a little too much to pursue that as a career option. And so I came back sort of looking for some more business-oriented, marketable career skills. And not unlike Amanda, I had a family friend who was able to make an introduction to me to somebody who worked at Baptist Health Louisville, who was also in strategic planning, who was able to offer me an internship for my last semester while I was at Center. And that was right when the Affordable Care Act was starting to be introduced, and it's when the community health needs assessment became an integral part to nonprofit hospital tax filings. So I was able to sort of translate some of those anthropology, sociology, community health type courses that I'd taken into an opportunity to fold that into a community health needs assessment with one of those hospitals. After that, I realized that grad school was the logical next step. So at graduation, I went and got my master's in health administration from the University of Kentucky. It was a 2-year program with a required internship or residency the summers between. Good opportunity to sort of focus some skills there. It's an important decision, when you're looking at how you want to go into healthcare and different healthcare fields. I'd say to think long and hard about getting your master's degree and the timing of it. So when you first get a master's degree right out of college, it's impossible to have the amount of work experience necessary to get jobs that actually require a master's degree. But at the same time, going ahead and getting that under your belt and not having to go back to school, when you're in your 30s is definitely something that I've seen some of my workers and colleagues struggle with that decision. So something to keep in mind there. When I finished grad school, I actually worked with Amanda. So something to keep in mind as well. You've got Center's a fantastic network in and around Kentucky. And so that first year of grad school, I was working with Amanda on a couple projects she had at Central Baptist. And that was a great opportunity. Just, I'm pretty sure I called her out of the blue and left her a voicemail after getting her number from Career Services. So take advantage of that network as well. And then when I graduated, I had done a little bit of work at the hospitals, but more and more healthcare is moving towards an intersection of where insurance companies and payers are just as aligned with the delivery of care as the doctors and hospitals that are actually on the front lines of that. And so for me, I wanted to go and work on the other side of the industry for a few years in order to get a better understanding of all sides of the field. So I went and did an administrative residency with Passport Health Plan, which is a Medicaid health plan in Louisville. And they're a nonprofit Medicaid health plan that's been in hold for about the last 20 years. So I worked with them for a few years before getting an offer to come down here. I'm now in Florida working for Health First. And so the sort of career Health First, we're a 5-hospital system with 170,000 member health. So really getting to work on the system side there, where it's right at the integration of what's changing with payment reform at the federal government level, but then also what's happening in the community from a care delivery standpoint. So that sort of just a quick update on who I am, where I've been. I'd like to hear any questions you've got.
Yeah, hi, my name is Drew Burns. I'm a senior. So this is really coming up for me and my interest. But can you walk me through what your typical day looks like? How much time you sit down at the computer for emails? What type of problems are you interacting with? What are the type of the major problems you deal with, and how have you gone about solving those? And what type of people do you work with in the healthcare industry?
So Amanda summarized my day perfectly by drinking coffee while you asked that question.
It's hot chocolate, John. I've
man.
got plenty of caffeine
All right.
so far.
So that's one thing I'd say. If you're going to work with physicians, you're up early, meeting when they can meet. So just something to think about. Amanda said it earlier. There's no typical day in this job, which is I think I like about it, and I think a lot of people who are drawn to it like about it. Obviously there's a lot of time in meetings, but there's a good amount of time out in the community and out in the hospitals too, which for me was really helpful in staying grounded from balancing that business and also doing good sense of the job. Being in the hospitals and seeing the work that you're able to do is really, really helpful on a day-to-day basis, just to sort of keep your head in the right space. But yeah, there's your typical emails and meetings and things of that nature. I would stress any experience you can get presenting, writing clearly and concisely, and working in Microsoft Excel is a great experience. And new hires the most. And so, any opportunity at Center you've got to work on those or through an internship or whatever it may be would be a great idea.
Yeah, I never fully appreciated all the writing we did at Center until I got to grad school and realized, wow, I can write better than maybe 70 to 80% of the people in my class. And a lot of that's just because of the liberal arts background and our requirements on writing. And so I think that it's so critical. We do a lot of written communication and a lot of emails and a lot of things that unfortunately get dumbed down in emails now, in terms of the skills that, we put to use when we're writing papers is not always there, but it comes in handy when anytime that you're in a meeting. I mean, you're verbalizing, I think, at a much higher level because of the background. So I think you all definitely need to give yourselves credit for the work that you're putting in now, because I think it definitely pays off from a professionalism standpoint when you get, out in the workplace. But there is no typical day, honestly. I'm just in a whole host of, I have my hands in a whole bunch of different things here. So although oncology and cancer services is probably my flagship service line that I work with, I'm also managing our housekeepers and environmental services, which is a staff of 104 people, and have a director that reports up to me through that. And so that's a whole nother set of challenges. And then it is dealing with our surgeons, and I do a lot of recruiting of physicians. I do a lot of counseling with physicians, a lot of counseling. Sometimes I think my psychology degree was, but there are So you're interacting with a lot of clinical staff every day. I mean, that's the majority of my day. So you pick up the language. You know, I definitely would never say, there's a line you don't cross, you know, when I talk to patients. You know, I almost know too much, but don't know enough to quite talk intelligently as if I was a clinician. But you do learn the lingo. You do learn whatever, you know, particular service line you may end up in, or you may end up in a business, in the business realm, and working as, you know, somebody in decision support, doing analytics, or in the financial realm. I focus more on operations, and so hospital day-to-day operations. So I worked on construction projects and electronic medical record implementations. And so those projects bring to the table a whole bunch of people with very different backgrounds. So you've got your physicians, you've got your nurses, you've got your techs, and your everybody down to your front desk staff that's doing registrations. And so you've got to be able to freely talk and get along with people. And I think that's like the biggest skill, you know, when I take residents, or if we have residents at the hospital that work with me or maybe shadow me. I think that's the thing that, you know, you'll go to grad school and you'll pick up this great skill set, but I actually don't really remember anything I learned from that classes. I couldn't point to it and say like, oh yeah, like finance it was horrible actually, but I don't really, you know, I don't take away a lot of, you know, that skill and go back to my textbooks. But the part that you can't teach that is so critical is your interpersonal relationship skills, and that will make or break you in the industry, bar none. If you can't figure out a way to get along with some of the most challenging people that you'll interact with, and I think that I've experienced some of those people, you have to figure out a way to work with them. And so I think that's the most, learning how to work with others and, you know, doing things in teams is all we do day to day. I rarely sit in my office. I mean, like I'm in my office now for this hour, but I'm looking at my calendar and it's packed back to back with very variety of different things, from addiction medicine and heroin to, you know, a research meeting. So it's totally different. So to answer your question, I can't even point to a day. And there's a lot of work after hours. You do a lot of things before and after work, and probably get 300 emails a day. So it's busy.
Okay, I'll piggyback on that.
Yeah.
To kind of respond to that, can you explain to me kind of the difference between the degree you got was called a Master's in Health Administration, is that an MHA?
Yeah. So there's different programs that do MHAs. Mine was actually a Master's of Science in Healthcare Administration. I don't know. It's MSHA. There are programs like Virginia Commonwealth that has a dual degree, and actually UK starting this with a JD, so you can get your law degree and your MHA. That was attractive to me at the time as well. I just felt my weaknesses were more in business and the finance and accounting realm. So I chose that focus sort of purposefully, even though I really do like now healthcare law and stuff is definitely very interesting. But I would, you know, recommend taking advantage of that. If you look at a program that offers those additional degrees, the more exposure you can get, I think just better prepares you. And there's a ton of programs out there. I mean, you've really got to look to see, you know, who has a strong alumni base. That was a big, important part to me, and why I really felt connected at UAB is because of just the tremendous alumni base that they have across, particularly the Southeast. You know, I knew I wanted to stay relatively close in the Southeast, and so that was important to me. It felt a lot like our Center Alumni Network, and you know, and it's sort of like we've got a ton of them within Baptist Health from UAB as well. So it's a nice camaraderie, and a lot of the programs do that as well. And it depends on what part of the country you want to live in, but they have sort of their own networks depending on where the school is.
So
the evaluation of a master's degree program, I'd say, to Amanda's point, should be much less about the name brand of that school and some of the classes you're going to take, and definitely more about where they can tell you their alumni are, what their network is, what some of their career support pieces are, because those are the things that are going to make the difference. The the academic rigor of a master's degree, whether it's a master's of business administration, health administration, whatever it might be, in my opinion, didn't compare to undergraduate work. It was more an exercise in checking those boxes and getting the connections you needed on the other side of that degree to jumpstart your career.
Oh yeah, I would highly agree with that. As much as I even hated the MBA, it really wasn't, it didn't even compare on the same level. It was just more or less about who you were meeting with and how you were connecting.
Right.
Does anybody else have a question? You can stop me. But I guess my question is, can you explain, like, because I'm interested in a lot of MPH programs as well. I don't think I understand where the work would change when you have a master's in health administration versus a master's in public health. Especially people who get MPHs, would you describe your job as trying to understand and reduce costs in the hospital setting or in the clinical setting while reducing medical waste? Are you more into the science realm of that? Or are you managing your clinicians and your staff? And you're kind of more on the financial side, I guess. But I guess the question is, can you explain the difference of if I were to go get an MPH versus get an MHA, how would my role change?
That's a really good question. I interviewed at UNC. It was apparent, and I had that same question that you did, and it was apparent to me the difference when I went there and interviewed. So I would argue, and this is very generalized, but I would argue if you want to work in a hospital or you want to work in a managed care facility or in a physician's large practice, you'd be better off getting an MHA. And John, you can correct me if I'm wrong. A master's in public health is, if you're looking at, say, not-for-profits, public health, departments of public health in cities, city planning with public health initiatives, agencies such as, why am I coming in of a blank? Community health agencies, advocacy groups, that's really where I would put MPHs. I don't really come across them too much in my field, which tells me that they're more into looking at population health potentially, and disease management, but maybe not acute care, which you experience in the hospital. So we're focused on, and not that we don't care about community health here, because like I'm working on an opioid initiative within our health system related to patients that are both opioid naive, coming in for pain, surgeries that require pain meds, and how do we make sure they don't get addicted and then, transfer off onto heroin or something like that. But then also like our horrible heroin crisis that we're under. So we work in conjunction with a lot of those community agencies, but that's not definitely not the focus of a lot of the work that I do. We're looking at managing costs, governmental infrastructure of healthcare reimbursement that none of us really knows what's going on from day to day, but managing to reduced rates, looking at how you do more with less, making things efficient. We do a lot of process excellence, a lot of Lean, Six Sigma, and so basically, how do you keep yourselves alive and making a profit, and running a business? Because a hospital really is a business, whether you're for-profit or not-for-profit. We're not-for-profit. I enjoy that environment more, but we still have to have a bottom line. So I don't know if that helps. I think if you really explore them, and I would encourage you, if you're really interested in it, to truly interview in both of those, because I think you'll feel the difference. And you'll, even looking at their class offerings, you'll tell the difference between those.
So I think it's also worth looking at how it pairs with your background too, right? So I had an anthropology sociology degree, and when I was looking at grad school programs, I knew I was going to take some of that community perspective into things. And so what I was missing were some of those business skills. So An MHA, in my opinion, is kind of like an MBA with a healthcare focus, whereas a master's in public health is really a different degree. That degree is less focused on getting you those business skills. So say you had a finance or economics major, maybe a master's in public health gives you a more well-rounded approach on some of those community health type issues. It depends on what you want to do, but how it pairs with your background, I'd say, is the key thing in considering which of those degrees you want to go into.
No, that's extremely helpful. So we have questions. I'm gonna keep it.
So you mentioned when you get an MBA, it's impossible to go into a position where you're qualified for with an MBA degree. So could you maybe talk a little bit about like some of the jobs you held where you felt like you were overqualified and how long you might have had those positions before you could move up?
So here's the thing. Amanda touched on it a little bit with the comment on boomers staying in the workforce. Healthcare is an incredibly popular field to go in right now. And I think it's a field where we have a lot of focus on clinicians entering into that administrative workforce. So what we've seen is as some of those clinicians, let's say a nurse who has practiced, has been in the hospital for the last 20 or 30 years, and maybe can't keep up with some of the floor work, but wants to move into a more administrative teaching type setting. You see those types of individuals moving into some of those management roles today. And so it's fairly competitive. A master's degree, you've got skills right now to do the work of an entry-level job without a master's degree. A master's degree prepares you for that management level position, but in my experience, at least, you're not going to be qualified management level position until you also have the requisite work experience to back that up. It's really trying to balance the two. I worked almost full time through grad school so that when I graduated, I could say that I had 2 years of experience starting out. And then the other thing with either an MHA or a master's in public health, almost always you're going to have opportunity to go into some sort of administrative residency. And that's a 1-year program where you're paired with a senior level executive at an organization, and you get that mentorship, but also the opportunity to work closely with them, and they give you opportunities to work on things that you otherwise wouldn't, right? So you're working on things at a much higher level than an entry level job, but you then very quickly over the course of that year are able to learn how to navigate politically in that organization and how to position some of the projects you might have.
Okay, wait, what was the question again? Sorry.
You mentioned that when you get an MBA, you're a little bit overqualified for a lot of the positions you're able to get. And like I was wondering, like how long, if you might felt stuck in a position where you were overqualified for too long, or if you felt like you moved up pretty nicely to the level you are now.
So I was very intentional about things. Very self-centered in a lot of ways right after I finished graduate school, and purposefully took positions even to the point of my residency so that I was exposed to the most I could be at once. So I picked an academic medical center to do my residency because I figured the challenge wouldn't be any harder than that. That's the most complex organization you can work in, is academics. So I started there, knowing that if I ever wanted to come down, it's easier to go down than up. And when you learn a health system. So a small community hospital, if you step your foot in that door, and a 100-bed hospital from day one, it'd surely be hard to go into a 700-bed hospital later that had a university associated to it, because your experience level is just very different. So I went that direction, and I've actually worked my way down. I don't necessarily miss academics. There were aspects of it that I liked, but so I was very intentional about the types of experiences that I got. And so some of that had to do with that initial residency and picking the person that I felt could train me and mentor me the best. And then, crossing my fingers, they gave me an opportunity after the residency to do what I, at that point, didn't really know what I wanted to do, but to go into what I wanted to do. And then I was I found an opportunity to take a job that I basically built a cancer center. And so it was an entire construction project in Alabama. And so I took that intentionally, not that because I wanted to live in Tuscaloosa, Alabama, but because I wanted to work on that project. And at 27 years old, put that I had built a cancer center. And so stayed there for about 5 years. And then intentionally took this position here because I felt like I was so stuck in cancer for 7 years of my career that I was afraid I wasn't going to get out. And so to touch to your point, you can get stuck. And so I wanted to shake that up a little bit and make sure the next position I went into that I opened the doors up to other opportunities so that I could transition maybe one day to a COO of one of our hospitals, and not be like the cancer lady that felt like I was starting to become. So I do think that a lot of it has to do with timing and who you know. And so that goes back to your network being very important. Your skill set's going to be there. You're going to have a great education. So again, I think it's finding the right position, being open to relocating and taking a little bit of a risk with that while you can, and not settling, and trying to keep challenging yourself, because it can be easy to get stuck. And, and there is, like John said, there is a saturation of healthcare managers out in the workplace. So, you have to sort of, if you're willing to move, it puts you at the front of the pack a little bit, I think.
Questions?
Me again, sorry. Do you see a lot of physicians either in med school or when they graduate going back to get MHA or entering into the healthcare management side of things, either to be more involved in the administrative side of things?
A lot of physicians, you broke up a little bit. So a lot of physicians going back to do that?
Yes, or doing a dual degree program of an MD, MHA, or MD and PH.
I don't see a ton. It does happen. Here's the problem is that we're doing a little bit better of a job of this, but we tend to pick the physician to be the leader who's the best surgeon in the group or the best at whatever they're doing. So it's that whole Peter principle. And sometimes it works and sometimes it doesn't. And then you've got somebody in there that's really not a good leader or administrator, but they're a great surgeon. You just took them out of the OR to help you run a department. And then you want to kill yourself because you're like, I have to deal with this person, and that's not their skill set, but we've done it to them. So we are doing a better job of creating leadership tracks in our organization for physicians, particularly those that are new out of school. They've finished their residency, they're coming in, and that have that skill or have that interest, and they have that respect among their peers. And that's the critical piece. I mean, I have a physician that approached me. They're like, oh, I want to retire in in like 10 years. And I'm really thinking of like healthcare leadership. And it just blew me away. Like I almost choked because I was like, oh God, like I can't imagine they couldn't manage their way out of a paper bag, but like, it's not their skill set. I'm just being honest. It's just not their skill set. They're a great, great, great physician. So they also liked architectural design. And I said, that might be even better path for you at retirement. But in all seriousness, we have to be more intentional about it. And we have to do a better job, because docs don't come out necessarily saying they want to do that. Room them a little bit. And then you have some that do. They go in and they get their business degree, but then that's sometimes because they're not really good physicians. So it's tough. The physician leadership piece is tough.
I think it depends too, somebody's considering going into med school, and it depends on what type of physician they want to be. If you want to be a private practice physician, family practice type situation, that's a tough road to do on your own today. And so any of that business background you can get before you go into that degree field is going to be really valuable. The physicians who we see, the really young physicians coming out of school right now, already by default have a better business background and an understanding of technology and risk related to payment and things like that than we have seen before, partially because med schools are doing a lot better job at teaching those things. So I've got actually a friend who went to grad school with me, who did an MHA with me at the same time, and then ended up doing a DO, Doctor of Osteopathic Medicine program. And so he's just coming out of that now and will manage his own practice and has enjoyed it. But it depends on what type of physician you're talking about. To Amanda's point, if you're going to be a surgeon, your focus probably in those early years when your skills are sharpest needs to be on perfecting that trade and not on business skills you could learn at different points in your career.
Thank you.
Other questions? This is your chance. Yeah. I have a quick question. Are there any associations in your field, public trade publications, anything like that that are worthwhile?
ACHE?
Yeah, ACHE,
Yeah.
the American College of Healthcare Executives, is a great organization to start off with. And they have different levels, I guess, that you can work your way up within that college to being sort of a fellow. It's a good place to start. It's a good reference for materials, and
they've got an early careers program as well, and they do have a
that's true.
I think a student membership's like $70 a year or something.
Mm-hmm.
But it's if you have a .edu account, even as an undergraduate student and not just as a graduate student, you could get a student membership to ACHE, and they have mentorship opportunities as well as another networking opportunity that Amanda, you may be better versed in the local chapter of ACHE now than I am, but I know that they have local meetings in Lexington and sometimes at school as well for that group to network and bounce ideas off of each other.
Yeah, we have a local chapter for ACHE, and so they have educational events quarterly, and it's a good network. It's a pretty large group.
Okay, thank you. Any more questions? No? Oh, can we get their contact?
Hey, is it possible to get your contact information after this?
Sure. How about I
can get it to them if you're okay with it.
Oh, yeah. No, yeah, that's fine.
Yeah.
Absolutely.
I just don't want to offer it without you wanting it. Offer it.
Yeah, sure. Yeah.
No, that's fine.
Thank you guys so much.
Any closing thoughts for you guys? While we have you?
Well, I'm excited. There's a big group in here that's interested in doing this. I think until John, I hadn't really seen many center alum. Well, Jordan Ellis was another one that came out of center. But, you know, I don't know that it's necessarily something that you think of because it's not really, there was not a lot of classes that would have led you to that, you know, into this particular realm. I think from what I heard, they might be exploring some of that public health minor at center, which is going to be great. I think it creates the exposure, but I'm excited that you all have an interest in it. And I think it's a fun field. It's definitely, if you like challenge and you like to stay, you know, completely insanely busy all the time with very different projects, it's the place to be.
Yeah, I would just have two things to add. One, just resume is a really important piece of paper. Keep it on one page and keep it really concise. They say that the average hiring manager looks at a resume for less than 30 seconds. So you've got a pretty small window to make a case for yourself. So any help you can get on formulating that document and really focusing on the high points is really helpful. And then just stay positive, stay with it. I know the points in my career where things have gone really well or where things could have gone better have been defined a lot by my approach to the situation and my willingness to sort of take a risk and take on work that may or may not be exactly within the scope of my job, but things where I could help out and turn it into a learning opportunity. So best of luck to you all. It's been good talking with you.
Thank you both very
Yeah.
much.